If history only remembers 1 in 1,000 of us, then that future will be filled with stories of who we were and what we did. But until that day comes, we will stand. We will look death in the eye, and we will fight.
Surgical nursing includes caring for patients before, during, and after surgery. To become a surgical nurse, you must have an associate's or a bachelor's degree in nursing. You must also either pass the registered nursing license exam or get a surgical nursing certification. An effective surgical nurse should have good interpersonal and communication skills, be good at decision making, be detail-oriented, be energetic, and have stamina and emotional stability. Having a compassionate and empathic nature is also helpful. Nursing jobs are expected to increase nationwide in the next few years. The U.S. Bureau of Labor Statistics says that employment of registered nurses is expected to increase by 19% between 2012 and 2022, and there are expected to be 9,230 job openings in California during that time. Nationally, the average salary for nurses is $66,640. And in California, the average nursing salary is $96,500.
The responsibilities of a surgical nurse varies by what area you are in. There are 4 areas of surgical nursing: a scrub nurse, a circulating nurse, an RN first assistant, and an operating room manager. Scrub nurses will assist the surgeon by passing him instruments and laying out the preoperative and postoperative care plans. A circulating nurse manages all the necessary care inside the surgery room, assisting the team in maintaining and creating a comfortable, safe environment for the patient and observing the team from a wide perspective. An RN first assistant is a preoperative registered nurse, and it has an expanded role functioning as a first assistant. An operating room manager provides direct and indirect patient care, supervises non-licensed personnel as assigned in acute care setting. The nurse communicates with physicians, the director, the coordinators, and the co-workers as appropriate about changes in patients' clinical condition and is able to respond quickly and accurately to changes in condition or response to treatment. Some of the most important duties to do before surgery are to provide pre-op instructions to make sure the patient has the right medication, blood tests are finished, and that all hospital bracelets are updated. After surgery, the nurse has to monitor for all the signs of the surgery going wrong and pain management for the patient. The potential problems or difficulties that are faced by surgical nurses would be efficient teamwork, minimizing injury, and attention to the patient and surroundings.
A current major issue relevant to perioperative nursing is incivility. Incivility is defined as rude and disruptive behavior, which includes bullying. There are many different examples of incivility. A few include eye-rolling, refusing to help a coworker, gossiping about a coworker, and a supervisor belittling staff. In a perioperative setting, stress levels are high, the workday is hectic, and every interaction is crucial. Incivility leads to more stress and frustration, which turns to impaired concentration and team collaboration, and greatly increases the likelihood of a medical error and compromised patient safety. There are many statistics that show us the full extent of incivility. A study published in the AORN Journal in 2013 discusses bullying among perioperative staff. 59% reported witnessing coworker bullying weekly. In a study conducted by Maxfield, 58% of nurses reported that they had been in situations where they were unable to get others to listen. In fact, fewer than 1 in 10 actually speak up to share their full concerns. The Veterans Health Administration discovered that 75% of approximately 7,000 adverse patient events were attributed to communication issues. As nurses, it is important to speak up be assertive, and resolve issues to the best of your ability. Effective communication between nurses and doctors is vital. Address incivility immediately to protect patient safety. We should all encourage kindness, respect, and forgiveness in the workplace.
The care of the patient and treatment depends on the age range the patient is identified with. For example, if you're dealing with a child, the surgical nurse will perform its duty in a more sensitive, tenderness, and loving way than usual. As a child, surgery can be overwhelming and scary. Therefore, children expect extra attention and love from a surgical nurse. This will comfort and encourage the patient to overcome the situation. For an adult, the expectations are required for a surgical nurse are slightly different. Adults also need support and comfort, but not as much as a child.
The relevant laws include Privacy Act, the Health Insurance Portability and Accountability Act, Healthcare Quality Improvement Act, Patient Self-Determination Act, and Medicare Conditions of Participation. The professional standards of a medical surgical nurse include quality of care, performance appraisal, education, collegiality, ethics, collaboration, research, resource utilization, communication, and leadership.